Hi, and welcome to the Future of Dermatology Podcast. I'm your host, Dr. Farah Kamangar, board-certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us.
At our SF Derm conference at Half Moon Bay, we had a wonderful lecture by Dr. Amit Pandya and Dr. Iltifat Hamzavi on vitiligo and all of the updates. This hour was absolutely fantastic. And you have had the pleasure of hearing Dr. Amit Pandya last week. It was an excerpt from his longer talk. And next week, you'll be hearing from Dr. Iltifat Hamzavi, who is absolutely fantastic as well. At the end, they also did a very, very cool case studies where they went over cases and kind of duked out how they would each treat it, which was fascinating and so much fun. I also, in the last 2 minutes of that hour, presented a couple of slides on our study that we are doing with Afamelanotide at our site at the Palo Alto Medical Foundation. And I'm going to review those slides here. I am doing it on the Zoom format here because it's a lot easier to see these slides than when I presented at our Ritz-Carlton meeting. So this is a trial that we are doing looking at treatment of vitiligo. The interesting thing about this study is that much of our vitiligo treatments so far have focused around the immune system. So Dr. Amit Pandya talked a lot about the mechanisms of what leads to vitiligo, but we know that the immune system is a pivotal part, and it's the immune system attacking the melanocytes that's ultimately causing the havoc. So a lot of our treatments are targeted at lowering that immune response and decreasing the attack on the melanocytes. We don't really have any great options, though, once we've decreased the immune response, to repigment. And that's the study we're trying to do here with Afamelanotide, which is an agent that helps with repigmentation. So we're excited to see how it works. Early studies, this is a phase 3, so earlier trials have been very interesting in this area. This is going to be Afamelanotide compared with narrowband UVB, which is a regular treatment that we use. So a little about Afamelanotide. Scenesse is the brand name. This is an analog of the naturally occurring alpha MSH, and it's a subcutaneous implant that gets implanted by this cannula device just in the suprailiac crest, and it's pretty easy to do. We know it at our site because this was approved for erythropoietic protoporphyria, and initially we'd signed up to be one of the sites for treatment for these patients. And so lots of patients have been treated so far for that indication. And so we feel pretty good that has a good safety profile. And so this would be a phase 3 vitiligo study that we're starting just now in Palo Alto at the Palo Alto Medical Foundation. And it's to use combination with narrowband UVB, which we're very familiar with, or phototherapy. And Afamelanotide offers a systemic pigmentary booster, we like to call it, and doesn't affect the immune system at all. It doesn't suppress the immune system. What we're really just trying to do with this is boost the pigment formation. And so first clinical results with Afamelanotide have shown best clinical response in Fitzpatrick skin types 4 to 6, and that's the group that we're going to be studying. It seems that they repigment pretty well with this therapy. So this is an open label 2-arm study, narrowband UVB with Afamelanotide versus just narrowband UVB, which is our standard of care. And the participants are going to have body vitiligo, but also for facial vitiligo as well. And as I mentioned, this is skin types 4 to 6 in adolescents and adults age 12 and up. And there are the main inclusion and exclusion criteria for this, which of course in our at our study site we'll go through pretty vigorously, but mostly we want to see how this does in our patients with darker skin types, because they also are going to have the one side effect of this, which is you'll kind of pigment at other places and it'll cause some tanning. So it'll be interesting to see the responses. Here are some photos. If you're listening to this on our podcast platforms, feel free to hop on to our YouTube page where you can actually see the slides. But the photos from the phase 2 clinical trials are pretty good. The repigmentation is what we're really excited about. Right now, I'm looking at a slide with a patient with lower extremity vitiligo in some areas that are tough to treat. And from day 0 to day 176, has had the implant, but also narrowband UVB and has really great repigmentation. The next slide is looking at eyelids, upper eyelids, and this patient is doing really well as well, in case you're not looking at the slides itself. Here's another patient from day 0 to day 134. We see really great repigmentation. This is also a patient with narrowband UVB and had 7 implants of the Afamelanotide since. And then here are some more photos that hopefully you're looking at the video, otherwise it's hard to see. So afamelanotide is a really interesting molecule. So I just wanted to bring some attention to it on our podcast, not so much necessarily to discuss our specific trial, but just to kind of bring it up to attention for some of our colleagues that might not have know as much about it. But it's interesting because it definitely has lots of indications within dermatology. And then off the pharmaceutical path, but kind of along the population, there are sort of copied versions of it, which of course we don't promote because we don't know where they're coming from or what they are. But it's kind of known as the Barbie drug, not the one I'm speaking of in this trial, but there are studies and articles written about people trying to use it for tanning, which we don't condone because who knows where things outside the pharmaceutical realm are coming from, because we know this group has done a lot of studies and rigorous testing and rigorous manufacturing requirements. So afamelanotide is an interesting one for us as dermatologists to be aware of. Thanks so much.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.